Good morning, Santa Fe, Nuevo Mexico, and parts north of I-25. This is another exciting program particularly today with the COVID-19 crisis, exciting program of Health para Todos on AM 810 KSWV Radio, 99.9 FM, and also streaming on the internet, KSWVradio.com. I'm your host, Arturo Gonzales, with my co-host,
Larry Martinez.
And Health para Todos is brought to our community by whom, Larry?
We're sponsored by Christus St. Vincent Regional Medical Center, Presbyterian Medical Services, the New Mexico Aging and Long-Term Services Department, and the Conalma Foundation.
All right, and we have had some pretty exciting interviews, Larry. You know, one thing we've been remiss on is that we haven't been able to say good morning to some of our listeners. So I don't think we want to go down individually, but I think we just want to say to all our listeners who we've identified before, please continue to listen to us because we value their attention, we value their support, etc. Right, Larry?
Absolutely, and I continue to be amazed at how many people listen to the show because when I'll be talking with someone, they'll tell me, you know, I was listening to your show the other day and I had a question about this issue that came up or that. And so they're a loyal group of listeners that we've got, wonderful people out there. And they tell me that they have learned quite a bit from our program in terms of understanding a lot of the aspects of our healthcare system that are not altogether that easily understandable. We tend to make things a little more complicated and complex, I think, than they need to be sometimes. But when people are getting news reports, there's not a lot of background information that's provided. And hopefully our program is doing a good job of providing some explanations as to what.
I sure hope so, yeah. So, well, you know, Larry, it's been an exciting few days. We have a new president who has committed to sending out the vaccines and getting them out there. There's a ray of hope. We are still under the COVID-19 crisis where numbers seem to be going up, and we're hoping that they begin to level off and come down. But one of the things that has been real hopeful is that we have two COVID-19 vaccines. And today I'm going to let you introduce him, but we have an expert on that from the Department of Health who's going to talk with us and talk to our listening audience on what's important about the vaccine, how to get it, and what we should be thinking of. Right, Larry?
Absolutely. And we're honored to have with us today Matt Bieber, who is the Director of Communications with the New Mexico Department of Health. And Matt, welcome to our program.
Welcome, Matt.
Thank you very much. I appreciate the opportunity, and I know that you all are providing such an essential service, communicating health information during this time. So I'm happy to offer my 2 cents.
Well, Matt, I have to ask you the question, so please forgive me. Are you related to Justin?
You know, someone else asked me, and I said, if I were, I promised that I'd be begging him for money and his help in getting more vaccine to New Mexico, but don't have those kinds of connections, unfortunately.
Okay, but you have connections to get the vaccine. So I'm sorry, I just had to ask the question, you know. Because if we didn't, then we would get response from our audience. How come you didn't ask a question of who he is? Okay, so let's start. What do you want to share with us, Matt, in terms of overall the vaccine, and then we'll get into some questions.
Absolutely. Well, if I may, let me just offer an overview of where we are in the country and in New Mexico specifically with vaccine distribution. So as you said, there are 2 approved vaccines right now. We have been receiving shipments for 5 weeks or so here in New Mexico. We're receiving them steadily. We place the maximum order we can every week. We almost always get it. I think the federal government downgraded the order once. We're receiving about 50,000 doses a week. And we're distributing that vaccine very fast. In fact, New Mexico consistently ranks, depending on where you look, among the top 10, the top 8, the top 3, the top 2 in the country in terms of how quickly we're getting vaccine into the arms of our population. Mm-hmm. However, there just isn't enough supply. And this isn't plaguing New Mexico in particular. This is a problem that plagues the whole country and many other parts of the world. So we're getting as much as we can. We're asking for more. And of the vaccine we do receive, we're distributing it like every other state in a phased distribution plan that's designed to get vaccine to the people who are most exposed to to COVID at their jobs, namely healthcare workers and other congregate care and first responder professionals. We're also now distributing vaccine to people in what's called phase 1B, the first two subphases of phase 1B, which include people 75 years and older, and includes any New Mexican 16 and older with a chronic healthcare condition. And the full list is listed on our vaccinenm.org website. So right now, to give you, to try to round out this answer for you, right now, somewhere between 500,000 and 1 million New Mexicans are eligible under the current criteria to receive vaccine. But again, we're only receiving 50,000 doses a week, which is really 25,000 new people, because we've got to preserve half those doses for the booster shot. Every vaccination requires 2 shots. Mm-hmm. So we're talking about vaccinating 25,000 new people per week, and lots more than that are eligible, and lots more than that are eager to receive vaccine. And as a result, folks are having to wait, and we're doing our best through venues like this and others to communicate the sequence and to give folks a reasonable idea of how long it might be until they have an opportunity to get vaccinated.
Well, Matt, you touched on one issue that has complicated the process and made it a little more complex. And one of the reasons for delay too is the fact that it is a 2 vaccination process. And so it's not just an issue of people simply getting the vaccination and that being the end of it. They get it, and then there is a period of time that has to pass before they can get their second vaccination. And I know as one of the organizations, many organizations, and I'd like you to talk a little bit about that, Matt, concerning who's out there administering the vaccinations to people. Among them are organizations like federally qualified health centers, other entities that are capable of doing vaccines. And I know people are working as fast and as hard as they can, but you're also having to make decisions in terms of distribution on the basis of which organizations can get the shots out fairly quickly. And so tell us a little bit about the organizations that are serving this purpose, because we're getting reports that there's shots being administered in high school gymnasiums across the state. There's clinics, and tell us who all is involved in this really major effort.
Absolutely. So let's start as broad as we can, and we'll narrow in.
Okay.
Speaking, there are about 400 providers in the state of New Mexico delivering vaccine, and that's everybody that you mentioned. It's everybody from Walmart to Sam's Club to CVS and Walgreens down to your local pharmacy or primary care provider or federally qualified health center, your local public health office. About half of those providers are enrolled in the state system. In other words, they are a part of the state registration website, vaccinenm.org. What that means is that when they partner with us, they enroll in our website, and then they can open up this schedule that they have for vaccination appointments, and DOH can fill those appointments by sending invitations to people in that area who are currently eligible. So once you've registered, you've done everything you need to do. You just wait to be contacted by DOH, and we contact you on the basis of which of the providers in your area have vaccine, and we get those invitations and appointments out to you. It works a little bit differently for the providers that aren't a part of our system. They do their own scheduling, they do their own communicating with the public. But as you say, vaccinations are occurring in all kinds of different fora. We've got drive-through clinics in Las Cruces. We've got in-store events across the state. We will have more large-scale vaccination events like the Pit at UNM. We're beginning to do in-home vaccinations for seniors who are homebound and others who need that kind of support. There really are there's a huge diversity of people in New Mexico with a huge diversity of needs, and we're committed to ensuring that everybody has support both with registration and actual vaccination.
So Matt, what I hear a lot of people, obviously this is a voluntary thing. People don't have to take the vaccine, but there's still some skepticism about the safety of the vaccine. I hear things like, well, it was quickly made. It really hasn't been tested enough. it should be more tested. I'm going to wait to see what happens to those that do get the vaccine, and then I'll get the vaccine. What would you say to those individuals who are a little bit uneasy about getting the vaccine?
Well, the first thing I'd say is I respect where that concern comes from. People want to take good care of themselves. They want to take good care of their families. It makes sense to ask questions. What I would say in addition is that the technology used to develop these vaccines was actually developed back in 2003 during the SARS crisis at that time. And there are some sound technical reasons why this technology allows us to develop vaccine faster than previous methods did. I'd also point out that these vaccines that have been approved have gone through tests with tens of thousands of participants. And the profile of adverse effects that we've seen in those trials are pretty mild. It's things like, a little bit of pain at the site where the vaccine is administered, maybe fever, small stuff. And thankfully, that's exactly what we're seeing now that vaccine is rolling out across New Mexico and across the country. And that's not to take a side in any kind of political dispute whatsoever. I think it's just a good thing for everybody that there really aren't a lot of adverse effects to be concerned about. We're just not seeing it in practice.
Well, Matt, we're learning a lot as we go along. But one of the questions that we received quite a bit of, quite often from our listeners and so forth, is the duration of the vaccination, the immunization from the illness, and it appears, based on what we've seen thus far, and I'm asking you this question: is how are we looking at what's going to become maybe an annual vaccination against coronavirus? Is that
you mean like the flu shot, Larry?
Yeah, just like the regular flu shot. When people take their shots, it's not something that once you've taken the 2 doses that you're going to get, if you're fortunate enough to get the shot this year, that's it. No, we may have to repeat this in the next few years.
It's a great question. It's an open question. Let me say first that I'm not a doctor, I'm not a medical professional, and so there's a limit to my expertise here, and I'd obviously want to connect you with folks who know the research better. But from my understanding, it is an open question on 2 fronts. Mm-hmm. One is how long the protection actually lasts. So that's the question you're asking, and we just don't know yet, I think is the short and true answer. There's also an open question as to how effectively the vaccine prevents transmission. So we know it's very good at preventing infection, somewhere in the 95% range, which is great. If you get the vaccine, you can be quite confident that you're protected from COVID-19. However, we don't have a clear set of data yet on how effectively the vaccine prevents you from transmitting the virus to somebody else. Mm-hmm. And that's the rationale. That's the reason why, even after we all get vaccinated, there will be a period in which we all need to continue those COVID-safe practices, wearing masks, washing hands, avoiding groups, etc. That's even when we know we're protected, we need to continue to do those things to protect the people we love.
Absolutely. Well, one of the things that makes this virus so elusive in terms of trying to address it and deal with it is we've seen just almost the entire range of possibilities with respect to how people respond to getting it. Some people have been asymptomatic, meaning they're carrying it, they're infected with it, but they've got none of the symptoms of people who are ill with it, so that they don't have the shortness of breath, the coughing, the fever, the other elements, and yet they can be playing a key role in spreading it to other people.
Absolutely, and that's happened. We know that's happened. In fact, that's for precisely that reason. That's why some folks have felt comfortable making choices that maybe felt safe and turned out not to be so safe in terms of getting the vaccine, getting the virus, and then transmitting it to folks in their circle.
Matt, you discussed the various phases of rolling out the vaccine, such as with the first line responders or providers, and then those 75 and over who have some chronic illnesses or something like that. Should children, teenagers, should they get the vaccine?
Well, they can't at this point because neither of the vaccines that have been approved for use under age 16. I believe it's Pfizer that's approved for 16 and up, Moderna is approved for 18 and up. Those vaccinations are currently being tested on younger populations, but haven't yet been approved. So at this stage, the answer is no.
Okay. Is there a difference between the two vaccines, between Pfizer and the other vaccine? Are they the same? I know they're different from how you maintain them in terms of freezing versus non-freezing, that kind of stuff. But is there any difference in their effect or in their capacity?
I can say a few things here. Again, we might hit the limit of my knowledge, but broadly speaking, the profile is the same. They have similar levels of effectiveness, similar side effect profiles. The one salient difference for folks is that Pfizer requires a 3-week wait between doses and Moderna requires a 4-week wait between doses. I believe there's also some research suggesting that one of them is more appropriate for seniors, more effective, or maybe a better side effect profile. But again, I'm not the expert in that area.
So when we go to these sites, let's say we go to Albertsons or we go to the Department of Health, do we know which vaccine they're going to give us, or do they tell us so that we could say, well, give us this one versus that one, or it doesn't make a difference?
It's a great question. My understanding is that within the state system, you do get an indication of which type of vaccine you'll be getting at the location at which you've been scheduled, and you always have the opportunity, or the right, I should say, to turn it down. You don't have to accept the invitation you're given. We encourage people to do that because there are so few vaccines available. In terms of private providers, I'm not actually sure how they're communicating that. I suspect it differs from provider to provider.
Okay.
Well, I'll just give you an example. Presbyterian Medical Services, which is giving the vaccines, ours are the Moderna ones, and we let people know that, up front, so if they want to take the Pfizer vaccine, they'll find a provider who's administering that brand of the vaccine. So.
Well, Larry, you say you have the Moderna vaccine? Did you also get the Pfizer vaccine, or were you just given the Moderna? And if so, why did they tell you that?
Well, and I think this is going to get into some of the areas we want to talk with Matt about. Moderna doesn't require the same intense freezing of the vaccine. In fact, I think you might have seen the early news reports that you had to have the capability of getting the temperature down to 95 degrees below zero Fahrenheit. And frankly, we at Presbyterian Medical Services don't have a lot of facilities that have got that capability. So I'm pretty sure that one of the reasons when we began our talks with the Department of Health, we had to let them know what capability we did have, and the Moderna vaccine can be frozen in a regular freezer, refrigerator freezer type combination. So that was what was more readily available to us, given what our capabilities were.
Okay.
We do have some sites that could take the Pfizer vaccine, but I think we're working with everyone to make sure that we in fact have the capability, the technological capability to store it without jeopardizing its effectiveness. And I early on in the process, we read that story of a transport of some of the vaccines to, I think it was in the Clayton area, which is one of those outlying remote areas, and some of the vaccine was no longer effective because the temperature in transport exceeded what was a safe limit for preserving the vaccine. So, which I think this sort of opens the door, Matt, and I think this is one of the reasons we wanted to have you on board. Is
this a segue?
Yes, this is a segue, right?
Okay.
I was going to tell Matt that he stated it very straight, in a very straightforward manner, all the things that have to be taken into consideration. But one of the things you talked about early on, Matt, was the fact that there are priority groups that need to get the shot. And if we're going to be in compliance with what the federal government is saying and everyone else who's got some say in this whole process, we have to be able to track who's getting the shots, and then we've got, again, the second vaccination, and usually we're encouraging the people who got their first shot to go wherever they went to get the first one, come back to the same place to get the second one. And we're giving away cards to people to do that. And even in a system like that, that's no assurance that people are going to remember or will in fact do it. So we've got reminder calls and all those sorts of things. But Matt, why don't you tell us a little bit about the priority levels? You already referred to 1A, 1B, and 1C. What do those consist of? And I know that's a critical piece of how the vaccine is being rolled out.
Absolutely. So let me start from the beginning. The CDC made this is the Federal Centers for Disease Control, made some recommendations for phases to states. They were recommendations. States had the right to tweak and adjust as they saw fit, and New Mexico did that on the basis of considerations specific to our local demographics, our workforce, our needs as a health community. We issued a series of phase requirements. They're up on our website, cv.nmhealth.org, and they are the governing document for the phase rollout in New Mexico. Now, I know that over the last, and I'll go into those phases in just a moment, but I want to make a quick comment on this issue of federal versus state guidance, because over the last couple of weeks, during the end of the Trump administration, the incoming Biden administration, there's been a lot of talk, a lot of news about potential changes to vaccine distribution schedules to eligible groups. Thus far, there has been no new federal law that overrides New Mexico's law. And if that happens, then we'll obviously adjust at that time. But right now, and for the foreseeable future, the governing rule for vaccine distribution in New Mexico is the plan that's on display at cv.nmhealth.org. And happy to answer any questions about it. Broadly speaking, 4 phases, as you say. That's in keeping with the way just about every state is doing it. And broadly speaking, states are doing it in roughly the same sequence because they have the same goals, which are to protect people most exposed and most at risk. So for us, phase 1A is healthcare workers, first responders and EMTs, staff at congregate care facilities. That can be everything from a homeless shelter to a detention facility to a juvenile justice facility. All of those people are eligible right now. That group numbers somewhere between 130 and 200,000 people. We are now in the first part of 1B, and I get that this is complicated, and we need to work harder to communicate this in a more straightforward way. We're now in phase 1B, which has 4 sub-phases. We're in the first 2 of them right now. That includes people who are 75 years or older, and that's somewhere in the neighborhood of 130 or 160,000 people in New Mexico. We are also vaccinating people who have at least one chronic healthcare condition. Again, the list is on the website. And that number is about 500,000 New Mexicans. So a quarter of our population qualifies in that subphase alone. We are not yet at the other subphases of 1B, and those include frontline essential workers like teachers and early childhood professionals. We are also not yet at the other final subphase of 1B, which is residents of congregate care facilities like inmates, juveniles and juvenile justice facilities, etc.
Excuse me, Matt, essential workers, you said would be like teachers, etc. on the 1B phase. Would grocery clerks or people involved in the grocery business also be considered in that phase?
Let me look for you, because there are, and this is a key distinction, there are, if you don't mind, can I explain the rest of the phases?
Yeah, I'm sorry, Matt, go ahead.
No, not at all, no problem. So I covered phase 1B, and as I said, the third subphase there, which we're not yet vaccinating, is what's called frontline essential workers. So that includes, I'm just going to give you a few examples. There's a full list on the website. Early education professionals, K-12, college, grocery stores, yes, food and agriculture, public transit, critical manufacturing, and some other categories as well. When we get to 1C, that's going to include adults 60 or older and other categories of essential workers. So that includes, for example, transport and logistics, utilities, energy and water, food service, and other categories as well. So again, I think it would probably bore your listeners if I read off every last category there, but they're all there. The plan is on display for anyone to read and ask questions about. And so if I can, let me just give a rough sense of timing. Phase 1B is big for the reasons I said earlier. It's going to include a large chunk of New Mexicans. We expect to get Phase 1B done sometime later this spring. At that point, as Phase 1B is ending, we'll open up Phase 1C. We'll do that hopefully in the late springtime. And then Phase 2 follows. And that's everybody who hasn't gotten vaccinated to that point, everybody eligible at that point. We expect that to take place in the summertime.
And that's taking into consideration that going through all those phases, you still have to anticipate that you have to give the second shot to all those individuals, right?
Absolutely.
So that's a lot of choreography, if you will, that you got to do.
But there is another complicating factor, and let me bring that up as, again, a representative of one of the organizations that's out there dealing with this on a regular basis. In the Moderna vaccine, and I'm not sure if this is the case with Pfizer, but we are getting the vaccines in vials of 10. And what that means is that when we open up a vial, we've got a limited time frame within which to administer the vaccine. So in some of the smaller clinics across the state, and I've been in communication with a lot of them, some of our organization, as well as other federally qualified health centers, in small areas, they've opened up one vial and they've had 8 people lined up for shots. Well, they have to try to find 2 more people to administer the remainder so that it does not go to waste. And so we're not having to worry about trying to preserve that. So that's one other complicating factor. And I believe the Department of Health has given us some flexibility when that happens, that someone may not be in 1A, but they could be 1B, and you still get them in. And then there's another qualifying factor which makes it a little more complicated. And I think this is giving us an appreciation, Matt, for the task that the Department of Health has in front of it in trying to manage this whole thing. When you have an individual who's 75 years of age and older living in a household, they have certainly are a higher priority to get the shot, but then also the people who reside with them should be getting the shot also. So even though the phases are distinctly defined, there are all kinds of factors which tend to make those lines of demarcation a little less clear and a little more fuzzy. And that's what I think makes this whole process so complicated and so challenging. Is that would that be a correct characterization, Matt, of what you're probably having to struggle with there at the Department of Health on a regular basis?
Absolutely. And if I can, I'll speak to each of those logistical examples that you offered, but I'd like to offer just a general comment to start, which is, because this is so complicated and because we all don't know everything about each other's individual situation, I think I've been finding that it's helpful to just have to approach others with good faith and trust in their motives. I hear lots of stories about, hey, I was in line down at the pit and I saw somebody who was 25 there. What were they doing there? And the first thought that comes to my mind is, well, where do they work? Are they a healthcare worker? Are they an EMT? Well, there's a lot we need to know before we make judgments about what's happening around us. And I get it that folks are eager to get vaccine, and it's a time where it's tough to kind of slow down and make those careful assessments. To the examples that you offered, first to the issue of small clinics, or really any clinics, who are at risk of seeing vaccine go to waste. It's a top priority to ensure that doesn't happen. And I'll say, thankfully, it hasn't happened, except for the one example you offered about that plane flight to Clayton, where we lost 75 doses because of the temperature issue. We haven't lost a single dose to wastage or spoilage in New Mexico, which is pretty remarkable because we've administered almost 170,000 doses at this point. We want to keep that track record going. And part of the way we do that is by issuing really clear requirements to providers about communicating with us. And this is especially easy for the providers that are enrolled in our system, because they have access to this website where they can tell us, hey, we've got 37 doses that are scheduled to expire in 48 hours. Can you help us by sending invitations to more people who qualify in our area? So there's a two-tier requirement, 48 hours, and then 6 hours. They're required to communicate again with us if vaccines at all at risk of going to waste. And as I said, we can provide additional invitations to folks, help fill those slots. If we can't do that, then we can give them permission to move to the next subphase, as you said. Because the key here is to balance these two important priorities. One is to ensure that no vaccine goes to waste, and the other is to ensure that vaccine goes to the people for whom it's most appropriate at this time. And so that requires a little bit of juggling, but folks, for the most part, are engaged with that, working hard in good faith. And I just hope that we can continue to convey that any effort at this scale involving this many people moving this fast with this many moving parts, it's not going to be perfect. There are going to be some issues at the margins. We absolutely want to know about those issues so we can work on them. But I do want to convey that for the vast majority of New Mexicans, this has gone very well. And that's borne out by the fact that we're doing this a lot faster than most states.
Thanks, Matt. We're going to take a little 1-minute break here so that Larry can do his thing for our program. Larry?
Okay, yes, let's remind our listeners that this is Health para Todos on KSWV, KSWV Radio, 810 on your AM dial, 99.9 on your FM dial, and we can be streamed at KSWV.
Yes, come on, bro, come on.
KSWV radio.com. And we are sponsored by Christus St. Vincent Regional Medical Center, Presbyterian Medical Services, the New Mexico Aging and Long-Term Services Department, and the Conalma Foundation. And our guest today is Matt Bieber, who is the Director of Communication with the New Mexico Department of Health. And Matt, first of all, let me just compliment you that the information you've been providing here during the first half of our program has just been excellent and wonderful. But I'd like to highlight one of the things you said just before we went to break, and that is that it's working very well with it's not without all kinds of logistical problems and challenges and issues. It's a complicated process. But, one thing that has struck me as being a part of an organization that is administering the shots is that our population's got to be complimented for not rushing and saying, I want to get out of line. I want to get the vaccine sooner than I should be getting it in terms of what the priorities are and so forth. I think everyone has responded extremely well. And as an organization that's at the front line giving the shots, the gratitude of people, because there are these organizations that are doing it. I think the gratitude towards the Department of Health for playing the key role that they're playing, and knowing that it's not an easy process, but as difficult as it's been, it has run relatively smoothly. We've not run into a lot of complaints. People are being patient. They're knowing that they've got to continue doing those things that are going to keep them healthy, but they're hoping to get the shot fairly soon. But they're also understanding that it doesn't happen overnight, and it's a logistical challenge to be able to make it all fall into place and work the way we hope it works, and if there's maybe it's because we are very sensitive, maybe this week more than any other week, to the fact that we crossed one very grim milestone, and that was with we passed 3,000 New Mexicans who've passed away as a result of COVID. And then nationally, we passed the 400,000 mark of Americans who passed away as a result of the pandemic. And people recognize that this is a serious issue. We need to take precautions and do everything we can. I know that the governor's directives have been second guessed by some, but I believe what the vast majority of respondents to the surveys and polls are saying is it's not easy, it's not fun, but it has to be done. If we're going to defeat this illness, it has to be done. So Matt, let me ask you, You did make a reference to the fact that the Center for Disease Control and Prevention plays a very key role in how this rolls out, and we also have New Mexico state law. At what level are the discussions going on to assure that that we're all communicating with each other and understanding? Half of the problem is understanding what direction we're being given.
Absolutely. Well, I can say that the governor's team is in regular communication with the Biden administration. Has the inside track as much as anyone can about what might be coming down the pike in terms of new vaccine-related plans. And I also know that within DOH, we're in regular communication with Operation Warp Speed, with the Health and Human Services Department at the federal level. So those lines of communication have been open throughout. None of that changed through the presidential handover, and that won't change. We'll continue to be in close touch with all of those people. And I think it's fair to say that the Biden administration really wants feedback from the states about how to do this better. This wasn't done as well as it could have been. Lessons are learned. No need to revisit all of that. But let's make sure that whatever plans roll out next reflect the needs we face as a country right now.
Well, Matt, it would seem to me, and of course, I'm not involved in those discussions, although I would like to be. But anyway, if there were changes, for example, from the Biden administration versus the Trump administration, it would seem to me that the major change would be get more vaccines out there, not on the protocol as to how they're to be given, but get the things out there, give more to states. Get more. I know one thing they said they wanted to get other individuals trained on how to give the vaccine. So, for example, you might have a nurse aide, or you might have, for example, even Larry, as an administrator of a healthcare clinic, might be trained to be able to give the vaccine if no one was available there. It seemed to me those would be the kinds of changes that might come about, don't you think?
I think you're naming the right family of considerations. If you look at the national papers today, there's coverage of the multi-point plan that the Biden folks have put forward. It includes some of the things you mentioned, expanding the group of people who's eligible to administer vaccine. It includes a huge request to Congress for funds to support the vaccination expansion effort. It includes proposals for bigger mass vaccination sites and stronger, faster distribution efforts across the country. It includes all of those things. I think we just have to wait and see what actually comes out in the wash. And in the meantime, I think have to continue operating with fidelity to the plan that New Mexico has put in place.
So excuse me, Larry, so given that you mentioned providers that are enrolled with the Department of Health to give the vaccine. Now, we know organizations like Larry's PMS, La Familia Medical Center, La Clínica de Familia, all of those centers are getting the vaccine to give to the community health center movement. But there's also places like Albertsons, CVS, and stuff like that. Can you name those that are also giving the vaccine?
It's a large list. On our website, actually on our public vaccine dashboard, which I can put here in the chat the next time one of you is talking, I'll put the link there. We have a full map of all the providers in the state, and they're divvied up according to two colors. The ones in green are the ones that are partnered with the New Mexico State registration website. The others are in blue, and they're the ones that are not partnered with the state. I want to clarify that everybody on that list has the legal right to administer vaccine. They've signed federal agreements about reporting to the government. They're all abiding by the law in that respect. But we do have two categories, one group that we're working with a little bit more closely. And I want to add to that we are eager to include more providers in our registration website system because it makes it so easy, one, to match users, New Mexicans, with providers and local vaccine. It also makes it very easy for us to track who's been vaccinated, and we have fuller information about all of that. Because one of the keys to this whole operation is getting clear data on who's been vaccinated and what percentage of our population has been vaccinated. That's how we're going to have to make decisions in the end about opening up the economy and restoring some aspects of our shared lives.
Okay, so if you can't, I'm registered. Larry already got the vaccine, right, compadre?
Yes, and I was one of those people at a very small clinic. They had 2 vaccines left over from a vial that had been opened and used. And they called me up, and I drove 26 miles down to Cerrillos to make sure we used that vaccine. And
Okay, Cerrillos, yeah.
Well, and regional directors at Presbyterian Medical Services, we come oftentimes in contact with patients who want to talk to us about our services and that sort of thing. So,
well, I didn't. I registered, Matt, and I'm waiting to hear from DOH as to where to go, what time. So far, I haven't been called. So what those of us who have registered haven't been called or waiting for something like that, what should we continue to do until we get the vaccine, or even after we get the vaccine?
Well, if you've registered, then you'll have received a confirmation from us that we've got you in the system, so you can trust that. But I'm also conscious that, it's tough to wait, and especially tough to wait if you don't know how long you're going to be waiting. And so we're beginning to roll out communications to folks who are waiting, just reminding them that you're registered, you can trust you'll receive a notification when vaccine's available, and to also offer updates on where we are with the vaccine rollout. So folks have a sense for being included in the process. They don't feel like they're left in the dark. And we've got some other ways that folks can communicate with us. We've got the hotline, which I believe Esteban was going to put in the right there at the bottom of the screen.
There it is. Okay.
And we've got just to give you a sense of the scale there, that's the New Mexico Department of Health call center. That's the whole call center, which has a large staff. If you call that number, you press 0 to ask vaccine questions, and then you press 4 for help with registration on the website. Just to give you a sense, when you do that, there are, by tomorrow, there will be 41 people staffing that option alone. So for New Mexicans who need help registering for vaccine at vaccinenm.org, there are going to be 41 people ready and willing to answer your phone call. So call that number, press 0, and then press 4, and you'll get assistance.
Very good. Very good.
One thing I'd like to convey to our listeners, too, is a little bit of an understanding. And again, this is part of the challenge that the Department of Health has had to deal with also. But for those of us who are in the implementation phase of actually administering the vaccines, a lot of the clinics were never built for mass vaccinations. They're there for primary care services in some of them in very small communities where they don't have large waiting rooms or areas to even really dispense them. The day that I went down to Cerrillos, which was New Year's Eve, it was New Year's Eve. Fortunately, the weather was very nice that day because there were a line of us all outside the building, 6 feet apart, waiting our turn to go in and get the shots. And but that's one issue. Another critical issue, and I'm not sure, Matt, if this came from from CDC or from the Department of Health, but since we don't know precisely how some people are going to respond to the vaccination, what protocol we've been following is keeping people 15 to 20 minutes after they've received the vaccination in the facility, and we ask them just sit down and we'll check with you. We want to see that you don't have any adverse reactions, but we also have to have a trained medical provider there who's available in the event that someone does have an adverse reaction. So there have been, and on some days, unfortunately, Matt, this all sort of hit us all when the holidays were coming, and leave had been approved for some providers to try and spend the holidays with their loved ones, that sort of thing. Hopefully, in groups of smaller than 5, but there were days when some of the smaller clinics, and some aren't even 5-day-a-week clinics, some are 4-day-a-week clinics or 3. And if there's no medical provider there, we could not be administering the shots. And that's what led to a lot of the frustration of people that, well, why the delay? Because, and we've got to keep people in the facility and make sure that before we release them to go, that they have not demonstrated any adverse reaction to the vaccination. That's been another issue that's been tough. But we've had to actually sit down and work out. Let's use the conference room for giving vaccinations, and clear that out and put in some dividers so there's some privacy on the part of people coming in. And it has led. It's one of those situations where it's been complicated throughout the entire process, even down to the implementation level. And we've learned a lot from this. I think we've learned, if this ever happens again, Matt, we're going to be one of the most prepared countries in the world in terms of understanding what steps need to be taken in order to make this all happen and work.
I think you say it well. There's a lot of lessons to be learned here. I mean, one of them is something that for folks in the public health community was no secret. America's public health infrastructure just doesn't compare with many of our peer countries, and that's a choice we've made as a country, and we can make a different choice about how to invest so that the next time something like this rolls around, we're better prepared. I think lots of folks are taking that to heart. One of the other lessons that I take from everything you just said, and I think it's connected to what you said before, is I think New Mexicans see it. I think they see the effort that folks in your organization, at the clinic level, the grocery store workers, all the people that are playing all the different roles to make sure that this gets done well. Let me give you one example. The other day, the pit at UNM opened the largest mass vaccination site in the state. And there were some hiccups, as should be expected. Some folks showed up early because they were a little eager. Some folks didn't bring the right documentation along, whether it's because they didn't read the instructions or because it wasn't communicated well. Folks, broadly speaking, responded with a lot of grace on both sides. UNM responded by making an inside space available so folks could stay warm. They set up a station right outside to make sure folks could check their documentation on the way in and didn't have to wait in line unnecessarily. And it's that kind of flexibility and grace and general kindness that I think has been on display by almost everybody in New Mexico throughout this whole period. And to me, it's heartening, and that's also appropriate. This is really complicated stuff. A lot of people are working really hard to get it as right as possible and making big sacrifices for their neighbors. And broadly speaking, I think folks are recognizing that, which is a really nice thing.
Well, Matt, on that day at UNM, 1,700 or more than 1,700 vaccinations were given. That's astounding. That is an astounding number, knowing how much time it takes just to do one vaccination. So, but the estimate was that if it could go that smoothly, ultimately we could be giving 3,000 shots per day, at a place like the pit, which was modified to address this contingency, and served its purpose very well. So
let me, Larry, before we, Matt, we are a bilingual station, and we do have listeners who speak only Spanish. So with your permission, I want to make sure that they get the number that you gave us and as well as what to do. So, mi gente, para la vacuna de COVID-19, por favor, pueden llamar este número, 1-855-600-3453. Otra vez, por el COVID, por información del COVID vacuna, pueden llamar el número 1-855-600-3453. Y cuando llaman ese número, te van a dar unas instrucciones que pegas el número 0 o el número 4. Pega el número 4 para que puedan darte la información de la vacuna y cómo pueden registrar por la vacuna. So, por favor, no dejen de penarse que no pueden llamar ni nada. So, porque, Matt, I would assume that when they do call that number, are there some bilingual staff that will help them through that?
Yes, there are.
Okay, so tienen gente que habla en español que te pueden ayudar para estar informado en este crisis de COVID-19. Thank you for letting me do that, because I think that's very important for our listening audience.
Absolutely.
And you said, Matt, documentation that they might have to take. What documentation do they have to take for the shot?
Let me say a couple things on the topic of documentation. So first of all, the broad point to make to absolutely everybody is that New Mexico is not requiring proof of residency, and we are not requiring any immigration documentation whatsoever.
Good. That's important. That's
absolutely. We also won't share any immigration information with the federal government. Your information that you enter into the registration website is HIPAA protected information. That's really sensitive information. The only folks that see it are a narrow set of folks at the state and then your provider who administers your vaccine. So high level point there is no need for residency proof and no need for any immigration documentation. However, part of the way, one of the primary ways we are determining which phase people belong to is based on where they work. So if you claim to be a healthcare worker and you show up to be vaccinated, you should expect to have to show some sort of proof that you do in fact work at the location you say you work. So if you say you work at a clinic, you can be, that could be a letter from your employer, it could be a badge, it could be other forms of documentation, but something, and your provider should be expected to check it. The same goes for health conditions. So if you claim to have one of the qualifying health conditions, there are any number of ways you can verify that, but do plan to bring some sort of documentation, whether it's a prescription or a discharge summary from the ER or a letter from your doctor, something that affirms you have what you say you have.
Okay, so mi gente, quieren llevar un poco de papeles, pero no se van a preocupar que inmigración o ICE, que eso es no lo que te van a preguntar. Y toda la información es confidential, como dicen en inglés. So, pero tienen a llevar información donde trabajan. Y usted trabajan, por ejemplo, por PMS, pues lleva tu badge de PMS que dicen que estás trabajando ahí. Y si trabajan en Sprouts, pues lleva algo que dicen que trabaja en Sprouts. Pero no van a tener miedo de inmigración ni nada de esos pendejadas que estaban pasando en pasado. Right, Larry?
That's correct. Very good. That was, that is all going to be extremely helpful. And one of the things that Matt talked about earlier was the fact that if you're registered, you're going to get contacted and you're in the queue for getting the shot. And one thing that I'm getting in terms of feedback from my clinic administrators is, when we hear that there's a group of people that are registered, it does wonders for streamlining the process and the waiting period. It really helps the process to move along. So everyone and anyone should do whatever they need to do to get themselves registered in the. Are we still calling it the state portal or the entryway or portal that the state has got in order to deal with the situation? But that's essentially it.
That's exactly right.
Matt, I don't know how to say this other than to say it, that you've been extremely helpful. You've been a wealth of information to us and to our listening audience. And as we begin to kind of wind this down a little bit, as you know, this will be on live streamed on the KSWV stream. It'll be heard in the morning on AM 810 KSWV radio. Are there any, what I would say, overall summary final thoughts that you want to share with our audience on this important issue of COVID-19 vaccines?
Primeramente, quiero decir muchas gracias para la oportunidad de expresarme y incluirme en este programa. It's so important that you're discussing these issues and offering this information to your bilingual audience. I think we covered it well. The key point for me is that despite some of the minor challenges, despite some of the imperfections in the rollout, broadly speaking, I think New Mexicans can take pride and maybe perhaps even feel some gratitude toward their fellow New Mexicans who are working so hard at so many levels to ensure that they and their loved ones are protected and vaccinated as soon as possible. And I'm not talking about the state there. I'm talking about all the work being done at every level of this state, down at the community level, clinics, grocery stores, mass vaccination events like you talked about, Larry, folks are really pulling out all the stops to help one another, and it's a pretty remarkable time. So, I know this can be a difficult moment in some ways, but I think we're also seeing some really wonderful and gratifying things about one another and about our communities. And I think it's helpful for me anyway to focus on that element of things.
Oh, definitely. Matt, just thank you. Eres muy amable de hablar a nuestra gente en español. Gracias. And I'm sure Larry appreciates that. Thank you. So our microphones are always open to you. I hope you know that. So you either contact Esteban or Larry or myself. Just don't call me collect. But if you need to do a repeat on this after you see it, we're willing to do that for you. If something else comes down, right, Larry, from CDC or from Biden, et cetera, that changes things, contact us, because we need to get that out to our public. But feel proud and satisfied that you're doing good work.
Thank you.
I want to give a shout out also, Matt, to your leadership there at the Department of Health. I know you have a new secretary designate with the departure of Kathleen Kunkel, and Dr. Collins has really stepped right in. She hit the ground running, and they're doing a wonderful job there. I think we should feel proud about how our state government has responded, because we've never lived through anything like this before. The last time we had a pandemic in this country was in 1918, when we had that pandemic that hit. So,
I don't remember that one, Larry.
I don't either, other than I studied about it. I know people accuse me of having been around at that time, but just just to sort of put it into human terms, I remember, I think I've told the story here on the air before, that my grandmother and I, we'd go fishing up in the little community known as Los Pinos here in New Mexico, which to get there, you have to go into Colorado to come back down into New Mexico to get there. But my great grandmother had lived there, and she was one of the victims of the pandemic that hit in 1917. And so my grandmother and I went through a cemetery there trying to see if we could find her grave marker, which we didn't, but we were amazed about the fact that about 80% of all the grave markers in that cemetery were people who died in 1917 or 1918, and right now Los Pinos is not a thriving community. It's a tiny little place with a few homes, and that's about it. And that shows, how deadly these pandemics can be. And so the work you're doing at the Department of Health, Matt, it's wonderful. The leadership that's been shown has been great, and we're all pulling for you, and we're all enjoying working with you to try to make this thing a success. And I know we started off the program saying we might not have enough material to go for an hour. We're at an hour, and time must fly when you're having fun, because it seems like we could go for at least another half hour and talk about the issues related to this. But you're doing a wonderful public service, Matt, and we deeply appreciate it.
Gracias, Matt. Nuestro público, gracias. Este es otro programa de Salud para Todos en la estación KSWV Radio AM 810 y 99.9 y en el internet KSWV.com. Gracias, señor Matt Bieber del New Mexico Department of Health. Y señor Larry, gracias. We are brought to you by whom?
Christus St. Vincent Regional Medical Center, Presbyterian Medical Services, the New Mexico Aging and Long-Term Services Department, and the Con Alma Foundation.
Con Alma Foundation. And Larry, we're able to do this work with Matt and with others because we have a motto on our program, which is what, Larry?
We are New Mexicans, not New Mexicans.
Ay, Chihuahua. Gracias for that, Larry. So gracias al público, and hasta el próximo to our next presentation. Gracias.